You know, there's lots of reasons why we have to pass health care reform. We absolutely have to. And we're just here talking about one of them today, which is the crushing cost on the middle class. Let me just read you some numbers. Earlier, Senator Cardin talked about 6, 12, 24. In Delaware, that 24 is $29,000. That means in 2016, an average of family of 4 in Delaware that makes $50,000 a year will have to pay $29,000 for their health care. 14,000 Americans lose their health insurance every single day. More than 60% of personal bankruptcies filed today involve medical bills. 75% of those personal bankruptcies involve Americans who have health insurance. Again, 2/3 of all Americans filing for bankruptcy because of medical bills already have insurance. The unemployment rate in this country recently at 10.2%. And more middle-class Americans are losing their jobs every day. And when you lose your job, you don't just lose your economic ability. We are where we work. You lose the respect. The hardest walk in the world is to go up and tell your spouse and your children that you've lost your job. And the worst part of it, in many ways, is that when you lose your job, you lose your health care insurance. I'm going to tell you a story about a Delawarean. Brandy Smallwood is a middle-class Delawarean who grew up in Wilmington, Delaware, but now lives in nearby Newcastle, Delaware. Brandy had worked at a jewelry store for the past 4 years, but like so many middle-class Americans, she lost her job this past spring. As a result of a dysfunctional insurance system, the loss of her job also meant losing her health insurance. Brandy currently receives $297 a week in unemployment benefits, an income that puts her over the limit for Medicaid or any other medical assistance programs. The harsh reality of her situation hit home when Brandy discovered a lump in her breast. Without insurance, Brandy was forced to pay out of her own pocket for the doctor's exam and a mammogram. Luckily, Brandy's lump was benign. Unfortunately, she has indicated that she will have to pass up any future medical care because she can only afford to pay her rent and utilities from her unemployment. She can't afford to pay any more for medical care out of her own pocket. That's why we need health care reform now, so that middle-class Americans have a viable insurance exchange to go to for affordable insurance when they lose their jobs. We have to do something so that middle-class Americans like Brandy no longer have to choose between paying their rent or paying their health care. We need health care reform now.